British Prime Minister Boris Johnson remains in the intensive care unit with coronavirus. He was moved to the ICU last night after his symptoms worsened. Johnson was taken to the hospital Sunday, more than a week after he tested positive for COVID-19. Our Ian Lee has the latest on his condition from London.
It's the biggest headline in Britain. Prime Minister Boris Johnson in a fight for his life, battling COVID-19 in the intensive care unit at this London hospital.
Well, I know I speak on behalf of the whole country when I say our thoughts are with the Prime Minister, his fiancée and his family.
Downing Street says he is breathing without a ventilator and has not been diagnosed with pneumonia. The 55-year-old was last seen in public Thursday night, worn out but cheering Britain's healthcare workers. Days later, his life is in their hands.
Well, my thoughts are with him and his family, because obviously it's a very worrying time for them and his loved ones, because it's very serious, and if people go into intensive care, obviously they're at grave risk.
Johnson spoke about his condition on Twitter Friday.
Although I'm feeling better and I've done my 7 days of isolation, alas, I still have one of the symptoms, a minor symptom of I still have a temperature.
The UK doesn't have a deputy prime minister, so Johnson asked Foreign Minister Dominic Raab to fill in. He told reporters the UK leader is in very good hands, as the fate of a nation now relies on them. Ian Lee, CBS News, London.
And what more do we know? Elizabeth Palmer joins us now from our London bureau, CBS News senior foreign correspondent. Elizabeth, what more do we know about Boris Johnson's current condition?
Very little. There was a government briefing about an hour ago, and the mood music was reassuring. But I have to say, Downing Street has downplayed the severity of his illness from the beginning. And so I think we have to be cautious. But the Foreign Secretary, who's now running the government, Dominic Raab, said that he was confident the PM would pull through. They said he'd had a comfortable night. As you heard Ian say, he's not on a ventilator. He doesn't have pneumonia. He's just receiving oxygen, and apparently he's in the ICU in case he should suddenly need a ventilator. So far, we're told he doesn't.
And we know Boris Johnson's fiancée is pregnant. Did she test positive, Elizabeth? What do we know about her situation?
She was ill with the symptoms. She's been tweeting, and they appear to be classic. So she's pretty sure she's had it. But no, she was never tested. In Britain, almost all the testing is on people who are sick enough to be admitted to hospital. She had left Downing Street, where she'd been living with the Prime Minister, to go to her own apartment, which is a few miles away in South London, about a week and a bit ago, to self-isolate. And that's where she is now. It must be hugely stressful for her, because she left Boris Johnson when he was having symptoms, but nothing like as sick as he is now. She's pregnant, as you mentioned. Their baby is due in the summer, and I can only imagine what a worrying time this must be for her, although she says she is gradually getting better.
Absolutely. What an incredibly worrying time. It's just hard to imagine being pregnant and how difficult it must be for her at this moment. I want to ask you about the Foreign Secretary. Our understanding is he's taking over for the Prime Minister, filling in at this moment. What do we know about him?
Well, we had a good look at him because he actually ran against Boris Johnson to lead the party. So if he'd won, he would have been the Prime Minister. He's a lawyer. He's 46 years old. He's got 2 kids, big political ambitions. He has been the Justice Minister. He spent some time in The Hague working on bringing international war criminals to justice. And he has been part of these government group briefings for the last few days. But I have to say that when he realized he was being handed the reins, he did look a little startled and maybe showed some trepidation, which is understandable because it's a huge responsibility. However, the Downing Street spokesman and the ministers themselves say, we run a government by cabinet. Dominic Raab is chairing the cabinet meetings, but the decisions are being made by consensus by the cabinet cabinet ministers. Journalists tried to push them into saying, look, if there was really a crisis, would Dominic Raab have the authority to make the decisions, some big decision? And he didn't really want to go there. The big decision that's looming, of course, is if the epidemic does begin to level out in London by the end of the week, as the evidence suggests, they're going to have to come up with an exit strategy to keep people on side. And it's not clear whether they can make that decision if Boris Johnson isn't well enough to take that on his own shoulders.
Elizabeth Palmer in London. Elizabeth, thank you very much for joining us with that update.